Dr. Amanda with StraightSmile Solutions, and I'm super excited to be able to demo this for you. This is introduction to indirect bonding from 3Shape. I've been asking for permission to do this for 2 years, so I finally got it today, yay. So for all of you general dentists out there that have the 3Shape scanner, it's collecting dust in your closet. I'm talking to you guys every day. I'm like, what are you doing with it? You're not using it for its full capacity. So let's talk about some of the cool things you can do with your 3Shape scanner. I know some people are all frustrated because they can't send it to Invisalign, but I do believe that you can make lemonade out of lemons and you can still do some awesome stuff, and you can do all this awesome stuff. So let's show you how cool this is. I'm gonna go ahead and play this demo video. You can find this on YouTube. It's not my video, it's theirs, but they said I could talk about it. So it's a 5-minute video. I'm literally gonna fly through it and just visit the highlights that I think are there. But basically, if you don't know what indirect bonding is and you're doing any kind of ortho, you need to get started with it because it is super easy. So sometimes you're going to have this patient that's just not compliant, or sometimes patients aren't looking for aligners, and they want straight teeth. Maybe you're trying to get the teeth set up over the bone, have more control over the roots, upright molars, so you can place an implant, guided surgery, that kind of stuff. Maybe you just want more control over your final outcome. Whatever it is, indirect bonding is great. And I think a lot of dentists, they get stressed out about bracket placement, and you really just eliminate that step. So all this stuff that you see here, that maybe you learned in dental school, you don't have to deal with it. So in any case, all you do is scan and then upload the scan. You can even show the patient what it's estimated to look for. We talked about the outcome simulator earlier in an earlier video. You can go ahead and it's really easy. If you get all overwhelmed with the library or the bracket placement library, we can just help you pick one or two. We being StraightSmile Solutions or your 3Shape rep can help you pick one or two great brackets. I always recommend having one mini twin bracket and having one self-ligating bracket. If I had to choose, I would say have 4 brackets. Have a mini twin metal, a mini twin clear, self-ligating metal, self-ligating clear. I don't care if you want to use 022 slot, 018 slot, whatever you want to do. And if you don't know what that is, I can tell you. But the cool part is you're going to go ahead and you're going to scan, and it's going to recommend the best arch wire shape for that arch form. And I think that's super cool that it does that, because that takes a lot of the guesswork out of it. And for those of you who are using some of these all-in-a-box indirect bonding companies, it's not great to just be using the same arch form for every patient, because it's not going to be stable. You're just going to blow these teeth and the roots out of the bone, and it's going to be really unstable, and you're going to have to be married to that retainer all the time. For sure, you're going to need a bonded retainer and probably an Essex overlay. So there's so many better ways to do this and to customize this for your patient and your patient's health and patient's periodontal status. So just FYI, and if some of this doesn't make sense, I'd be glad to take you through it slowly. So yeah, that's my suggestion. If you're not an orthodontist, just have those 4 brackets. They can go ahead and set up your bracket library with that. It can help you get the right arch form for the shape of the patient's mouth. You're going to go ahead and just push a button. The brackets are going to kind of go where they need to go. You can fine tune them like they're doing here, but you don't have to do that. And then it's going to just basically show you what it's going to look like once it's all straight, like you see on the right. Okay. And nowadays you can go ahead and direct 3D print the transfer tray, or whatever you want to call it, matrix, like what you see right here in yellow. You can direct 3D print that. You can export that to a lab and they'll mail it to you, or you can do it in-house if you like to have a 3D printer in your house, but that's really, really cool in your house, in your lab, in your office. So in a nutshell, this is the summary chart right here that I like. It's really good. You scan your patient, then you virtually place your brackets. There's pretty much just a button for that. You're going to approve the placement. Now this is an important step right here. I want to point out how much time this can save and how much time this will save for the case. Okay. So on average, and there's some data for this, I think on average, this is my personal Dr. Amanda Wilson, StraightSmile Solutions, personal experience. I think you'll save at least 25 to 30% of case time, if not more, if you use indirect bonding over direct bonding. Because as much as we try to stand on our head and get the bracket placement right, and that is for orthodontists, okay? If you're a general dentist, you're gonna save probably 100% of case time because you just don't have the experience. So you will save so much case time. So a 24-month case is now an 18-month case, or a 12-month case. So because it's just going to go on perfect. And you're going to start with your 14 nai tai and let it cook for 3, 4, 5 months. If you're using self-ligating brackets, you don't even really, I mean, I would use like a dental monitoring kind of monitoring system to monitor your patient and have them come in when needed. You're going to obviously have to trim that wire as it aligns, but how cool is that? You're barely even going to have any chair time for that initial wire, you know? And I'm a big fan of getting into rectangular wires and even getting into steel as your final wire. I don't believe you should finish cases in a round wire. That's just my personal philosophy. And I think every orthodontist will agree with me on that. But, you know, you can move into that. You're gonna go ahead and approve the bracket placement. If you approve the bracket placement, that means your team member can bond those brackets. You have to be in the building for most states, but, you know, or around, but you don't have to be sitting there passing the brackets back and forth, directly manipulating each bracket. And how much chair time will that save you? Talk about doctor chair time. I'm sure 15, 20 minutes a day is much better spent doing something else, you know. Tray design, okay. And you can bond them in sections, you can bond them full arch. I mean, ideally full arch would be great, but I recommend starting with sections. Yeah, just slap it on, bond it, you know, double check the patient before they leave, tie them in, and you're good to go. So yeah, I mean, you can do this if you're outsourcing to a lab. I'm guessing they're going to charge you maybe around 200 to 200-ish, 200 to 300 is what I'm hearing for the tray, maybe a little less, a little bit more if they have to put the brackets in it, if they're stocking them for you, if you have to stock them yourself. But I mean, that's a really great price per case. And of course, you may need treatment guidance for that. Feel free to visit StraightSmileSolutions.com. We can help you customize this and have really comprehensive treatment plans, ideal bite correction, ideal outcomes, torque in the roots, just perfect. You can do it as well as an orthodontist can do it. You really can, using the right kinds of technology that's out there now and the right treatment philosophy. So in any case, hopefully that helps get you excited about your Trio scanner that's sitting in your closet, and hopefully you're gonna use it more. Any questions about labs that you can send your indirect bonding cases to for printing, let me know. I'll be glad to refer you. If you need help screening your cases, let me know as well. All right, thanks so much. Have a great day. Bye-bye.